Hello, this is Dr. Gay from First Look MRI, and this is a patient I had shown earlier on another video. They had a ruptured flexor tendon in their fifth digit, but they also have this entity, which is avascular necrosis of the lunate bone, also called Kienbock disease. Some people call it lunatomalacia, but it's abnormal blood supply to the lunate bone. It gets weak and can collapse or just slowly deform over time. And here is the lunate bone right here. So the scaphoid bone, lunate bone, triquetral bone. Here's the distal radius. Now, a lot of times we see the lunatomalacia associated with an ulnar negative variant. So an ulnar negative variance is when the ulna is too short relative to the radius. Usually there's a little gap here that the TFCC fits into horizontally. And if the lunate bone is the ulna is too short, then that'll cause abnormal pressure between the radius and the lunate bone and lead to lunatomalacia. But again, this is a neutral variant, so that is not the cause. And we see the capitate bone here. It looks like it has migrated proximally a little bit. We see this often when they have a ruptured scapholunate ligament and the joint is widened here and it can migrate down. And that may be sprained or partially torn, but it did not look like it was ruptured and it wasn't really wide. But we can see there's complete loss of joint spacing between the capitate bone and the lunate bone here. And there's some darkness, which is reactive bone sclerosis, all throughout the lunate bone. And they also had a few little bone erosion scattered around and just diffuse joint space narrowing. So I believe they have rheumatoid arthritis that's causing these findings in the proximal wrist. And then there's abnormal stress between the capitate bone and lunate bone, and that may be the etiology for the avascular necrosis there. This is a fat-suppressed T2 or stir sequence here. We can see there's also some reactive marrow edema within the capitate bone, so some stress-related changes. And that also could be seen with rheumatoid arthritis and just the proximal migration and joint space narrowing. And also here, the triquetral bone had similar marrow edema, but the lunate bone has the most marrow edema and also that low signal on the other sequence, which is probably some reactive fibrotic changes on top of the marrow edema. But no collapse at this time. Again, this is an example of avascular necrosis of the lunate bone or Kienbock disease. And thank you very much.